History of United States Healthcare by Heather Watterlond, HCA 205, Introduction to Healthcare, November 22, 2015. Good evening. My name is Heather Watterlond. I have been a community health educator for nearly a decade. I have also been a nurse for nearly 20 years. In just that short time span, I have seen the drastic changes that have come with each new year. Through this presentation, I will look at the history of healthcare in the United States, major events that led to healthcare as we know it today, and lastly, look at the roles of stakeholders in the industry. Let's look at the timeline. United States healthcare is defined as a collective of institutions, resources, and personnel that deliver quality healthcare to meet the needs of the population. The U.S. healthcare system was born in the 1920s. Prior to this, the so-called healthcare system consisted of doctors making house calls to the general public. If a member of the household was sick, they would be quarantined to the section of a home away from others. The doctor would arrive, evaluate the patient, and give necessary treatment. For most doctors, they were not paid in cash but in exchange of services. For example, if the man of the house was a skilled tradesman like a woodworker, he would offer services to the provider in exchange for medical care. Many diagnostics like blood draws and checking urine tests could be done at the home. They could also do minor to moderate surgical procedures in the home. At the time, general anesthesia was still not widely used, so surgeons were limited to the patient's ability to tolerate pain. Hospitals were not the greatest place for patients at the turn of the century. In fact, they were known to be filthy and a major contributor to the spread of bacteria and disease, along with nurses and doctors not washing their hands when going from one patient to another, nor at that time did they know not to do this. Home visits towards the end of the 1920s reduced and hospital stays became more prevalent as more hospitals followed a plan by the Marine Hospital implemented nearly 120 years previous. The first Marine Hospital is documented as being one of the first publicly funded, pre-paid insurance program in our nation's history. President John Adams signed the Marine Hospital Fund Bill into law in 1789. The law guaranteed care for members of the U.S. Merchant Marines, United States Coast Guard, and several other members of government agencies. The Marine Hospital is so significant to the modern healthcare because the foundation of most of today's programs come from this model. Fast forward 100 years to 1847 when the American Medical Association was formed. Prior to the AMA being established, doctors were truly practicing medicine. The AMA was formed to create a standard of practice for all practitioners across the country. The first code of medical ethics was established. Standards of education were also set, thus changing the level of care in the United States forever. The association describes the AMA as representing the best of American medicine and today continues to serve as an advocate for the profession, the physician, and the patient. As we entered a new century, the tools and foundations for successful healthcare were present in terms of care, but the financial aspect was still a major issue. President Franklin Delano Roosevelt and the Great Depression put into motion better ideas to accommodate healthcare needs of all citizens. Franklin D. Roosevelt was the first president to speak out and say that all citizens are entitled to healthcare, and it has been a hot-button topic ever since with every president to follow. FDR attempted to pass a universal healthcare system, but was unsuccessful and settled for the establishment of the Social Security system. For as great as the Social Security system is, it did not address the medical needs of our country. With a failed attempt at a national health care, another door opened, that of private insurance. On the campus of Baylor University in Texas in 1929, a group of teachers came together to brainstorm and form the first private healthcare company, known as Blue Cross. The concept was to pay a fixed rate for a set number of days in the hospital. This model of insurance would lay the foundation for every insurance company that came after it. You can fast forward to 2015 and still see this plan with a twist being executed every day across the country. An industry standard model is DRG, Diagnostic Related Group. For example, an insurance company negotiates a set price to be paid to the hospital for the care of a patient with a specific diagnosis. DRG is the most common of contracts set between hospitals and insurance plans. As we move further into the 20th century and private insurance is up and running and available to more and more citizens, focus changes from funding, but to care and quality of product. Questions start rising about quality of care. Essentially, are the insurance companies and the patient getting the most for their hard-earned dollar? In 1951, the Joint Commission on Accreditation of Hospitals, JCAH, was formed. Now known as JACO, JCAHO, organization was added several years later to include urgent care doctors, offices, and independent surgical facilities. JCAH was established to evaluate health organizations, regulate and manage care that is being provided. In addition, JACO has set industry standards for every hospital in the country. A patient should be able to walk in to any of the 21,000 JACO accredited hospitals and see the same standard of care at every facility. Joint Commission takes care of quality and delivery of care, but a nagging issue still looms in the background. Not every American was receiving health care. Young Americans and their families were having no trouble getting private insurance, but our senior population, those over 65, were being turned down by companies like Blue Cross and Blue Shield. In July of 1965, not long after taking office, President Lyndon B. Johnson and Congress created Medicare, giving medical insurance to anyone 65 and over, regardless of income or medical history. The Centers for Medicare and Medicaid state Medicare is a social insurance program that spreads financial risk across society as opposed to private insurance that adjusts prices according to the perceived risk. Besides coverage for inpatient and outpatient services, the program expanded to provide payment for prescription drugs, to cover younger people who have permanent disabilities, and to cover individuals with end-stage renal disease, and to provide hospice care. With the creation and implementation of second and third-party entities that have access to patient records and sensitive medical reports, the question of patient privacy now arises. How would we keep this very private information from becoming public knowledge? With the technological advancements happening all over the world, the ability to obtain and pass information on almost every imaginable topic and every person in the world, safeguards needed to be implemented. As the medical community pushes towards the end of another 100 years, HIPAA, the Health Insurance Portability and Accountability Act, is established. The primary goal of HIPAA law, which was enacted in 1996, is designed to provide privacy standards to protect patients, medical records, and other health information provided to health plans, doctors, hospitals, and other healthcare providers. When HIPAA was first introduced, the medical community pushed back with large, forceful voice, but hospitals were quickly realizing that the law was not going anywhere. Most medical corporations, whether doctors' offices or hospitals, have a HIPAA compliance officer that is dedicated to making sure their facility abides by all rules and regulations associated with this law. As you can see, the 19th century and the majority of the 20th century were spent creating, molding, and modifying our present-day healthcare industry. The world of healthcare is large and takes so many people to make the gears run smoothly. Those would be the stakeholders. Stakeholders are made up of 4 types of individuals: patients, employers, providers, and payers. Healthcare professionals, i.e. nurses, doctors, pharmacy techs, social workers, and many more, view quality in a technical performance mind. Doctors and nurses are looking for accuracy of diagnosis. If the right treatment plan has been ordered, they measure this by the resulting health outcome of their patient. The next major stakeholder would be the patient. Patients want compassionate, empathetic care from their providers. They want providers with skills but yet clearly communicate through the care and process. Hospital employers are another group of stakeholders. This group walks a tightrope every day. They want to keep their costs down, provide excellent patient care, and provide excellent benefits and support to their employees. Last but not least of the primary stakeholders would be payers. Their job is all about cost effectiveness. Payers tend to see medicine in a very black and white picture, very little gray zone. Payers want providers to adhere to evidence-based, precise diagnostic plans and reach a treatment plan with the fewest visits and least number of tests. The biggest discord amongst all stakeholders is that of provider and payer. The provider wants to treat the patient regardless of cost, and the patient or the hospital as long as they fix the patient. The payer group wants to do all of those things but with the least amount of cost. As you can see, the 19th and 20th centuries have been a whirlwind of change for the healthcare industry, and the 21st century is falling right in line. Every day we hear of amazing new technology, medication advancements, and how the community is moving more and more towards patient-centered care. The next century is sure to redefine healthcare again in the United States. I hope you've enjoyed this presentation. Thank you.